guys, Kim here, and you are tuned into Kim E, the Diabetes MP, a place where providers can come and learn more about diabetes education and management. And I am happy to be sitting here with you today. Like I mentioned in my last video, which if you haven't caught that one, I'll put a link in the description box. We are in Black History Month. It is February, and a habit of mine, something that I tend to do and have been doing for the last couple of years, is I make a lot of content around African Americans, the Black community, when it comes to diabetes education and management. One thing that I wanted to do this year is really focus on Black communities in healthcare. One of the big reasons why is because, as we all know, there's a lot of racial disparities, not just in the Black community, in many different marginalized groups. But because it's Black History Month, I am a Black woman, definitely feel like I have to address this. It is my responsibility and duty to always champion this conversation. And so this month we're going to be talking about Black communities and healthcare. Today we're going to get into how to better individualize care for those in the Black community. Now, when it comes to individualizing care, this is something that research has shown us that we have to approach the patient, as a person, individual person, and really take into consideration a number of things. There are many different approaches, many different steps, and, different resources out there that you can follow to help you to better individualize care for your population. And like I mentioned in the earlier video, the previous video, is that I have had the opportunity, the pleasure to be able to sit and do a number of corporate workshops, a number of corporate trainings where I am actually working with healthcare leaders and executives and administrators. And one thing that I have found is that across the board, no matter where you live and what your demographic is, patient engagement is something that we all need to A, pay attention to, and then B, figure out how we can increase the patient engagement. Now, like I've mentioned in the last video, patient engagement is not just getting your patient to engage with you. It also, that's just one component, but it's also how the provider also engages. It's a continuous cycle. And so as I have been sitting and talking with different groups, healthcare groups, I put together an approach of my own, and it's called the A cycle of patient engagement. Now, I do a whole private training over this where I'm actually digging in and we're actually doing work. People are not just sitting in a lecture hearing me talk about this. We're actually writing things down. We're trying to get to the root of where the breakdown of communication is within each person's unique population. Now, the A cycle is something that can be used with any demographic. It is something that can be used with any patient, but it's especially good for marginalized groups like the Black community. And so what I would like to do today is just briefly give you an overview over what the A cycle is. And again, it is much deeper than this. It's actually like a few hours of training where, like I said, we're actually doing like interactive work together. I'm working with the different healthcare leaders and execs and administrators where we're actually writing things down and we're reflecting and we're having discussions. But today I just want to introduce to you all what the A cycle is, okay? So let's get right into it. So when I introduce the A cycle of patient engagement to a group of people, we actually go through a whole cycle where we're sitting and we're talking about each individual A. It's the A cycle. So each point starts with an A. You have assess, you have activate, you have advocacy, and then you have adjust. So let me briefly define what each one of these stages, these points are. So assess. So typically when we hear the word assess or assessment, we immediately think about assessing something else. We immediately think about assessing the patient or the environment But in this particular this particular A, I take time to actually say, let's be reflective and let's assess ourselves. Where are we? How are we doing with engaging our patients? What areas can we get better in? What are some opportunities that we can do to increase our patient engagement? And that's what I mean when I say that we're actually working, because this is a discussion. This is time to jot down, to brainstorm. But these are the types of things and questions that we're asking and really reflecting and thinking on, so we can at least say, where is my facility when it comes to patient engagement? How can we get better? Where do we see ourselves? Because here's the thing, if you don't know where you're at, you don't know how far you can go. You don't know how far you should go. You have to first be very aware of where you're at. It's not to be ashamed. It's not a time to be, your feelings to get hurt. It's not a mark on how good of a provider you are or a clinic that you are. It's simply saying, where are we and where do we need to be? That's what assess is. Activate. So this is where we start to pull in our patients, but we're also holding on to providers as well. We need patient activation as well as provider activation. You can also call this buy-in. We need a buy-in not only from our patients, we need that buy-in from our providers. One of the things that I noticed with a lot of organizations that I have worked with is that many people could not get their staff to rally behind the mission or the vision of the services that they were given. Now, that is definitely something that leadership definitely has to lean into, but in that step, that's where you evaluate that. Okay, how do we activate our providers? Because activated providers activate patients, okay? You cannot have activated patients without having activated providers, okay? And so this is where we do a lot of polls and surveys, and we talk and we ask, what is it that's keeping you from screening that patient from prediabetes? Why are we not being more proactive? I had a client that said that when they did this, what they found is that it's not that the providers didn't want to screen. It's not that they didn't want to refer for DSMES or MNT, medical nutrition therapy. It was because they felt like they didn't have time. Well, why do you feel like you don't have time? I don't have time to chart. I don't have time to see the patient chart and get all these referrals out and read the notes. And so what we did with that particular client was we talked about how we could create more time for their providers in their workflow, their clinical workflow, having a time, integrating a time of administrative time so they can see patients, but then they also have a very dedicated and protected time to chart and to make phone calls, return phone calls, get on calls with providers and patients and pharmacies or whatever. But they had that time to be able to do that. And in those times, people are not rushed. They're not feeling like I have to do everything. And so things were not being missed. Things weren't being sacrificed. Quality wasn't being sacrificed. Now with your patients, this is a great opportunity for you to ask your patients what their pain points are. Now, I am a huge advocate for this. It is great to know the standards and the guidelines. I am not saying we throw that off. Clearly, if you have viewed my channel, you clearly know that I am always talking about algorithms. I'm talking about the standards of care. I'm currently, I currently on this channel, all last month, I went over the standards of care, the new 2022 standards of care. So I definitely am an advocate for evidence-based medicine. But if you can't get your patients to come in and to stay coming back, who are you doing these guidelines for? You're doing it to crickets. So you got to get them in and get them to stay to be able to get them to an algorithm, to be able to get them to treatment, right? So this is the time where you need to talk to your patients and ask them, what are their pain points? What's important to them? What are their barriers? Because what you can then figure out, how can you be of a better service to them instead of running on the hamster wheel and doing all these great things, but it's getting you nowhere. You're now realizing, okay, this is what's important to my patients. This is how they feel heard. This is how they feel seen. And this is what is keeping them up at night. You want to understand we're here to be of service to them. Advocate or advocacy. Now, I can talk. Like I said, I have a whole spiel over advocacy. I believe in my heart of heart, I know this to be true, that is a big portion of what we're doing for our patients. We're advocating for them. We're not just speaking on their behalf, but we're also connecting the dots for them. We're lining up resources for them. And I understand, I have had so many people to say, like, I don't have time. Again, like I mentioned earlier, we then need to jump into, well, then why don't you have time? What's going on in your workday that's sucking all of your time? Okay? Because we cannot be fully productive if we're not practicing quality care and at the standard. So the standard is telling us we should be here. That's where we start. How do we go beyond that? And what needs to adjust so we're able to do that? Okay? And so advocacy can look like community resources, partnering with other organizations. In the different workshops that I offer, this is a place where I am talking to the individual clinic or health system or whoever the person represents. We're actually talking about what's in their community, and we're pinpointing leads and who could lead that up and who, how could that be of service to your patient population? Who can you partner with? What can you automate or systemize where this resource is already built into your everyday system, where you're not having to go and do this step each and every time. It's just a part of your workflow, and so that is something that would really be helpful to delegate. This is where delegation is great. This is where sharing the workload, that is something that will definitely open up some time for you and give you your time back when you're partnering with other people who may be doing this particular thing that you need all the time, every time. Or maybe this is an organization that has a little bit more resources than you do, and you can partner together. Again, it's always keeping in mind being of service. What is it that our patients need? What are the things that they're saying they need? And how can we offer this? What can we do to be of better aid? It's not being everything for them, but what is something that we can do to participate to be better of a service to them? And lastly, adjust. So again, I say adjust because just like with any goal, just like with any task, as you're in it, especially if it's something that's new, as things change, as things grow, you start to see, what? Maybe this was a little bit too much that we bit off. It's too much to chew. Or maybe we actually need to redirect. Maybe we need to pivot. Maybe we should start offering this service to help us to be able to better serve. You're always looking to improve, always evaluating and adjusting. One of the biggest reasons you would need to adjust is to maintain patient-centered care. We're always wanting to keep our patients at the center of everything we're doing, right? And so as patients' preferences change, as their cases get more complicated, maybe they get less complicated, we're readjusting, right? And so adjusting is just a part of the game, and it's also one of the reasons why this is a cycle. It's not linear. At any point in time, you may have to re-enter the cycle. You may see that, maybe we need to go back to the drawing board and we need to reassess, okay? Maybe we need to go back, maybe that resource in the community, maybe we're not able to use that resource. What other resources are back there? That's what that adjusting is all about, okay? It's not a linear thing that we have a start point and then a stop point. It's a cycle. This is something, that's the thing about chronic disease management, is that this is something that people are going to be doing for the long haul, and dare I say, in some cases, for the rest of their lives. Okay, this is a diagnosis, this is a condition, especially with diabetes, that people are going to have to be mindful with and intentional. Even if they're in diabetes remission, they have to continue to do the things that put them in remission. They can't just throw away all of the behavior changes and modifications that they've acquired. They have to continue to do this. So this is a lifelong lifestyle change. Okay, guys, I hope the ACE cycle of patient engagement was very insightful for you. Again, like I said, I do a whole day workshop over something like this. And so if that is something that you're interested in for you in your facility, please feel free to reach out to me. I'll put my contact information in the description box. If you're new here, I would love to have you a part of my subscriber family here. So please subscribe, ding the notification bell so you never miss an upload. I also do live streaming, so you'll be notified when I go live. If you do social media, I am over on Instagram at the Diabetes MP, and I am also on LinkedIn, the Diabetes MP, or you can search me at Kimberly Ellis. Again, you have been sitting here with Kim E, the Diabetes MP, and I'll catch you on the next one. Bye.